Well, the debate over reopening schools rages on, and there are still a lot of questions about how the virus could impact children. Janelle Bluda connects the dots.
As parents and politicians struggle with the question of opening schools, new evidence suggests kids over 9 can spread the virus just as much as adults. Let's connect the dots. First things first, most health experts agree that children are less likely to suffer severe cases of coronavirus, though it does happen and a small number of children have died. Though evidence is mixed on whether they are less likely to be infected, there is research to indicate they are much more likely to be asymptomatic. The new research on children spreading the coronavirus came out of a comprehensive study done in South Korea on thousands of patients. It found that younger children 9 years old and under were less likely to transmit coronavirus to others, but for kids over 9, they were just as likely as an adult to pass along the virus. When it comes to transmission rates in school settings, that is a lot harder to measure. There are many countries that have reopened schools after coronavirus lockdowns, but according to the Kaiser Family Foundation, those countries had lower rates of community transmission than the United States, more testing, and more contact tracing. So right now, it is hard to find a comparison. Connecting the dots, I'm Janelle Bluda for H-Town Rush.
Janelle, thank you. For more information on your district's plan for the fall, just text the word schools to the number that just popped up on your screen there. You heard it, 713-526-1111, and we'll send you a link with information.